We're here with Robin Hogan for HCCH new video podcast. So
Yeah.
we're glad to have you this morning. We're going to talk about OB services here at HCCH. And it's my understanding it's been about a year since you started doing those.
Yeah, it has, absolutely. We have three providers here that see OB patients. I have Dr. Baker, Dr. Mahler, and Ashley Harding, who's a nurse practitioner. And it's really been a great program for this area. A lot of patients have to drive all the way to Kansas City or Des Moines for a 15-minute appointment, and all they do is have their belly measured, listen for fetal heart tones, and get weighed, and then they're on their way. So, with the way the economy is right now, with gas prices and everything, this has just been a really great program where patients no longer have to take off a whole day from work or anything like that. They can just come right here in the clinic, have those things done, and be on their way. So we see patients all the way from confirmation of pregnancy up until delivery. So we don't actually do delivery here. We have a collaboration with North Kansas City Hospital. So our patients will deliver at North Kansas City Hospital.
And I think you told me before we went on the video that you've had, is it 9 so far? Or you have 9 in the program?
We have 9 in the program right now that are active, and we've had 7 deliveries.
So when somebody decides to use the OB services here and then transfer to North Kansas City, just give us a little bit of an update what they can expect as they go into the OB program.
Absolutely. Like I said, so they'll do all of their appointments here as long as there's nothing found to be super high risk or anything. And then at 20 weeks, we send them down to North Kansas City to have their 20-week ultrasound anatomy scan. And then they'll also do a tour of the maternity ward there. So they'll be familiar with where they will go for delivery.
And I'm sure it takes a little bit of equipment, as does everything medical-wise.
Absolutely.
So what type of equipment does Harrison County Community Hospital have for OB services?
Yeah, so we have been very fortunate to get some really great equipment for OB. We recently have got a non-stress test machine, so we can do NSTs here in the clinic, which is really great in those last weeks of pregnancy to check fetal heart tones and movement to make sure that baby is doing well and doesn't need to be delivered a little early. Actually, just last week we had one that wasn't showing great movement, and we went ahead and sent them down to North Kansas City, and a healthy baby was delivered.
And we're fortunate here in Bethany to have qualified staff for that. So I think you mentioned about who was on staff who did the OB services, but just tell us a little bit about what each person does in their specialties.
Yeah, absolutely. So Dr. Baker, Dr. Kimberly Baker, she did a lot of rotations in OB, so she's very comfortable with OB. I would say she's kind of our leader of the program. And then we have Dr. Mahler. He is an MD here at the clinic, and he is also comfortable doing OB as well. And then we have Ashley Harding, our nurse practitioner, who's done a lot of women's health. And she's in the OB program as well. So all three of them are great providers, and I would recommend any of them for our OB program.
So anybody out there is watching this, wants more information, just tell us a little bit about how we can get more information, who they can contact.
Absolutely. You can just call the clinic here at HCCH Medical Clinic at 660-425-3154. And we would be happy to get you set up with one of our providers for an OB program or for an OB appointment. And yeah, we're just hoping it's going to continue to grow and that we can help more patients in our area.
Once again, with Robin Hogan from Harrison County Community Hospital about OB services. Thank you.